Hey there, good afternoon. Very glad I say that. Good afternoon and welcome to TRAXXfm. Today we have a special interview, and in the studio with us is Dr. Halimatul Aris, who's a medical officer, National Population and Family Development Board of Malaysia. And today we are talking about something very interesting, something that I believe that needs to be spoken out and heard by people of Malaysia, because today we are talking about family planning advocacy in conjunction with World Contraceptive Day. Good afternoon and welcome to the studio, Doctor. How are you today?
Hi, thank you, KG, and hi to all the listeners too. Okay, good afternoon. I'm good. Ready for the interview?
Ready.
Yeah.
Let's do this. Okay, Doctor, this is a topic that is rarely spoken out in big stages. And today we are talking about something very interesting on radio, because this is a topic that I can honestly tell you I've never done on radio before.
Okay.
Contraceptive, because the moment you say contraceptive, there's a lot of stigma behind it and all of that. But today we are here to break all of that. And we're going to talk about what does it actually mean. Okay, so we start off with this question, Doctor. What does contraception play an important role in building a family? Why?
Okay, so when we talk about building a family, right? So whenever the decision how, when, how big the family is, usually it plays around the husband and the wife. So how does contraception place in this small institution? Okay, so number one is contraceptive is going to help the couple plan the timing of the pregnancy, plan the size of the family, and ensuring that they are emotionally and financially prepared for children. Okay, so it's not really about, oh, I don't want to get pregnant. It's not about stopping pregnancies. It promotes health. How it's going to be promoting health of the wife, the family is number one, enabling safe pregnancies, reducing unplanned pregnancies, and with that, empowering individuals. You're empowering this woman, you're empowering the partner to be supportive in their reproductive choices. So ultimately, couples and families are healthy, emotionally and economically stable. So I feel that in such a small institution, actually contraception plays and helps such a big role.
Mm-hmm. Absolutely. I like the part where you emphasized on the safety aspect of it, the economic safety, especially the partner's health.
Yes.
Because right now, a lot of people are getting married, but then they're at that stage where economically they might not be stable, might not be able to provide for the child at the level which is currently needed. Because as you know, costs have gone up. Cost of raising a child has gone up tremendously. Right. And let's move on. Many couples may have questions or even concerns about using modern contraception. Truth be told, not many of us understand modern contraception as well. Could you share an overview of the available modern contraceptive options as well as their effectiveness?
Okay, sure. So maybe first, let's try to make the listeners understand or differentiate for those who maybe have a little bit like confused, right? Okay, what is traditional contraception and what is modern contraception? So more traditional contraceptions is, for example, the pull-out method or the calendar method, not using any sort of like pills or hormonal help or IUCDs, yeah?
No external stuff.
Yes, you're right. I agree. So the most common modern contraceptive methods include first hormonal options. So there's a lot. We have the birth control pill, we have the patches, and then we have the injections. Okay, barrier method such as condoms, and also long-acting reversible contraceptives. So we call it LAC. So what is it? Sounds so fancy, right? Long-acting reversible contraceptive. So what LAC is actually, it's a device that once you use it, that one device is going to be effective for a longer period of time. Okay, so number one, we're talking about intrauterine devices, which is called IUD, or in Malay we call it alat dalam rahim. So depending on its type, it can last for one use 5 to 10 years.
Oh, wow.
Yes. So for couples who are trying to plan for a longer term and don't want to worry about taking pills every day, so this might be suitable for them, right? We also have implant, or I think it's more popular outside, it's called Implanon. Okay, that's the brand of it. So this can last 3 to 5 years. So all these methods sometimes are overwhelming to the ladies, right? Like, oh my God, which one am I going to choose? Which one fits me? But this is what I'm always going to tell them. I always use this term. Please correct me if I'm wrong. One shoe doesn't fit all. right? So it's like we're Cinderella. I always try to make it fun for my client, right? So they don't feel like the topic is too serious for them, because sometimes to some, coming up to you takes a lot of courage. Yeah, so you're like a Cinderella trying to find that shoe that fits for you. So don't be afraid. There's always a contraception that's going to fit for you. So consulting a healthcare provider is important. So come up and see your doctor, go to the nearest clinic, because to decide what contraceptive is for you, we have to ask questions. That's why when you come to the doctor, so many questions they ask, because we need to know what's your personal need. What's your view, what's your lifestyle, and then what's your health status. And then we will suggest to you. And we will see which one you can use, and then we'll go forward from there. Yeah.
Right, understood. And also the medical history as well, just to make sure that they are safe to be able to receive all of this. And, and of course, there are many couples out there that may have questions of doubts, or as you said before the interview, the myths of it in using modern contraceptions. Can you share with us the modern contraceptions that are available right now and their effectiveness?
Okay, so misconceptions and myth. I've been working for 8 years. Previously, I was with Ministry of Health. Now I'm with LPPKN. So many. And I've been I was working in Sabah before. I just got transferred to KL 2 weeks ago. So I have been working in rural areas. So there's a lot of myths going on. And although some myths, like I couldn't even thought about it before, but these are valid because they are doubts, because it's their body. Of course, they are worried, right? So common misconceptions, for example, number one is they are afraid that when after using hormonal contraceptive, for example, after taking the pill, that you won't be fertile anymore. It will be difficult for you to get another baby after this.
Or you can't reverse it.
Yes, oh no, I think if I take this pill after I stop, maybe it will take me years before I have a baby, they say, right? Okay. So that is not true. It works to stop you from getting pregnant only when you're using it. So after you stop, then your fertility will return as per usual, as before. Okay.
Understood.
Second is about IUDs, intrauterine device. So some might think, only people who have delivered babies can use IUDs.
Oh, okay.
So IUDs are inserted inside their uterus. Okay. So they would think, only if you deliver. No, actually it's safe for our ladies who have not delivered any babies. I think one of the most popular myths are, am I going to get fat?
That is a big concern.
Am I going to gain weight? And of course, that's something I think even after 30s, I think everyone worry, even for men and women, I think. Not
yes, I'm worried about that.
Yes, okay. So there's a lot of, it's subjective. There's a lot of factor. I mean, with our age, our lifestyle, our eating habits, and also our metabolism as we age, So it's subjective, as in there's a lot of factor that is affecting weight gain. So it's not usually the contraception, but this is what I usually tell to my clients. If you do experience it, please don't be don't be, I don't want to use contraceptive. Come and then we'll talk about it, and then we'll see if there is a contraception that maybe is more suitable for your lifestyle then, right? So debunking this myth is very important, because we want to provide women and we want to provide their partner the confidence to choose. And after all, this accurate information, that's the only way to give this accurate information, is the way for them to make informed decisions. And I think tailoring that to them will make them more confident, and then they're also more happy with their choice. Yeah.
All right. Okay, doctor, what we're going to do, we're going to take a short break.
Okay,
we're going to listen to a couple of songs, and once we come back, there's more to talk about, because today we are talking about a very unique topic, family planning advocacy, in conjunction with World Contraceptive Day 2024. In the studio today with us is Dr. Halimatul Aris, Medical Officer, National Population and Family Development Board, Malaysia. Don't go anywhere. Well, that was Young Love with Sexy Lady right here on TRAXXfm. Welcome back. This is KJ, and in the studio joining me today is Dr. Halimatul Aris, the medical officer from National Population and Family Development Board, Malaysia. We're talking about family planning advocacy in conjunction with World Contraceptive Day 2024. Doctor, what are some misconceptions about contraception that you as a doctor commonly encounter?
Okay, mine is quite interesting, maybe, KG, because as I was saying, I was in Sabah previously, right? So, and I was in the field. I was working around 2 years in a maternity clinic. So I remember one lady came and then she told me that she was using injection method. Yeah. And she said like she wanted to stop. And she told me she wanted to stop because she has not been bleeding for a few months. And this is one of the common alterations that will happen when using injection method. And actually, it's not harmful. It's just because of how it works, causing that there's there's going to be less period intervals. Okay, it can be a side effect from that. Okay, but it's not harmful. And so I was asking her, why would you want to stop? And she said, because I've not been bleeding for a few months and I think that the blood is up to my lungs now because it's been accumulating.
Oh, wow. That is her understanding of it.
Yes.
Oh.
So then it occurred to me, okay, so it just needs a little explanation. So we sat down and I explained to her. So this is how it works. And the reason why you're not bleeding is because this and so that. Yeah. And then she was happy. So happy after she heard that. And she was saying, doctor, that's so good. So I said, so do you want to continue or would we want to change the method? Because for her, it's easier because she lives in a rural area. So coming in, every month wouldn't be suitable for her. So her method requires to come every 3 months. And she was like, okay, I'm going to continue. If it's no problem, I'm going to continue. So I think this story I've brought up in a few interviews because I felt that it was close to me. And that's why whenever I give training for doctors, I always have to explain to them, whenever we're explaining about contraceptives, whenever we're explaining something medical, you have to go down to a level where they could understand. And you have to help them make informed decisions. Yeah, so I'm happy. Eventually, she did change to LAC, long-acting reversible contraception. That's I feel that's she enjoyed it more. I mean, she required that was more suitable for her lifestyle because she decided that she had completed her family. But there was an experience of a myth or a misconception that I always carry around during talks because close to me. Working. So
It's just that sometimes certain groups of people or certain areas, they might not have the understanding required for this. But the thing is, all of this is very, very normal.
Yes.
And contraceptives, especially in the Western nations, they are much more, widely accepted and for the reasons that you are already telling us today. And let's ask this one. For women and their partners out there who are wishing to start on family planning, where can they access such services?
Okay, so now in Malaysia, widespread access to contraceptive methods. So through government health clinics, so Klinik Kesihatan, to LPPKN clinics, through private clinics, and to community pharmacies. So at LPPKN, we operate 50 clinics all around Malaysia, and it's called Klinik Nur Sejahtera. We offer a wide range of contraceptive options for women and couples. So go to your nearest clinic, get your advice from your healthcare workers, okay? So interested couples can come to Klinik Nur Sejahtera or visit our website www.lppkn.gov.my. I repeat, www.lppkn.gov.my for more information and support in making informed family choices.
Absolutely. Thank you so much, Doctor. Now, before we end the interview for today, I would just like to add an absolute pleasure talking to you. But would you like to add anything for our listeners out there?
Yes, sure. So take proactive steps in planning your family. Again, like I said in the beginning of the interview, family planning is not only to prevent pregnancy, but also to ensure the well-being of the mother, child, and in the end, the whole family. So with good planning, you can plan the family size that suits your needs and readiness, as well as take care of the health of your loved ones. So use effective contraception, avoid unplanned pregnancy, #merancang keluarga sejahtera.
All right. Thank you so much, Doctor. An absolute pleasure talking to you today. Now it's about time that we end. But before that, I'd just like to say, interesting topic. We spoke about family planning advocacy in conjunction with World Contraceptive Day 2024 with our guest, Dr. Halimatul, Aris Medical Officer, National Population and Family Development Board, Malaysia. With that, it's time for more music to come your way, but we will be back later. Right now, this is